Today I'm going to walk you through an advanced anti-aging treatment. The purpose of this particular facial mask is to increase that vascular activity, to tone the facial muscles, and to gently exfoliate. So let's get started. When starting this particular treatment, you want to be sure that the client is laying as flat as possible. It's very important that the shoulders, the décolleté, and the head be as even so we can increase that blood flow. We're going to start our facial treatment with a liquid water-based cleanser, pH balanced. Alright, now that our client's skin is cleansed, we're going to move on to our advanced anti-aging treatment. We're going to start once again in the décolleté area. We want the mask to dry evenly. We're going to take it in sections, and I'm going to bring it right above the heart, as close to the heart as possible, right above the breast area, so we can increase that vascular activity. Nice long strokes as we're moving, and we want to get as much skin as we can. So all the way to the tips of the shoulder. Okay, if you look closely before we step away, I want you to notice how that carotid artery, you can see that movement in the skin. It's not uncomfortable. She probably doesn't even feel it happening yet, but you can see that pumping that blood, and that is the key to healing skin. All right, we're going to take a little bit of the cleanser, and this is going to feel a great relief to the client, particularly in the neck area because it's tight. So we're going to get that, just some of that removed right now to soften it, and then ever so lightly I'm going to take the cleanser over and she is feeling relief for sure. Next, I'm going to take our facial wrap. We want to make sure that there's enough water, but not where it's sloppy, dripping, okay? And we're going to begin. You do not want the wrap, the towel, to be too warm for the client's skin. We're just going to lay that over. Is that comfortable? Mm-hmm. Okay, and here we go. And so what we're going to do is we're going to start softening it. Just slowly, gently, not too much pressure. And I want you to notice as we do this, the color of the skin. We want nice and pink. Even some clients will get a little red. The purpose of this treatment is to increase that blood flow, so red is okay. We're just going to kind of use it that way. And you can see, coming off easily. We're going to do the same process again. And what I really like about the facial wraps here is it holds the heat. Again, we don't want too much heat on the skin directly, and it also is going to hold that water so we can have a little more moisture to be able to remove. Okay, and again, nice and easy. Because it's terry cloth on one side, we can have it multi-used. And look, beautiful pink all the way up. And I had asked her on the break if she was feeling that pulsation up in the cheek area, and she said yes. You can see again, maybe in here, that carotid pumping. It's still moving that blood, and while it's pumping that blood, it's healing. But she's nice, evenly pink. And that's what we're looking for. All right, I'll continue the removal process and we'll get back. Okay, so we have our advanced anti-aging mask removed. I'm going to do a final wipe through because, as I said, there's always a little bit of residue left. We just want to make sure we get everything off nice and gentle, but particularly in the crevices right around the mouth area. Bring it up around here. We're going to go underneath that eye one more time. Look up for me. Take it like this. Very gently. We're going to start with a serum, a water-based serum, and this particular serum that we're going to use today has bakuchiol in there, and bakuchiol is an alternative, a plant-derived ingredient, alternative to retinol. So again, with that anti-aging, this really does assist in the healing of the skin. And I want you to notice we're bringing more blood flow. Very gentle, very non-aggressive, but more blood is coming. So this serum that we're using has bakuchiol, which is an alternative to retinol without side effects. It also has niacin in there, which is going to increase some blood flow. And it has peptides in there as well, with a variety of other ingredients in helping to heal the skin. So we're going to do 2 passes with the LED light. We're going to first, we're going to bring it like this. And this particular device is it's timed, so we're going to do 1.5 minutes in each section. We're going to start in the décolleté area, and we're going to just move very gently back and forth. I get my own rhythm going. And so why do I choose to use the serum, let's say, for an example, with my first pass? The machine works. We know LED works beautifully. We want to ask ourselves, how can I get the most out of this treatment? What else can I add to it that's going to assist in moving that skin further along, okay? And in our case, we did a lot of experimenting, and we thought that this was the most beneficial, that the results really were incredible. So again, very lightly over the skin in sections. I'm gently touching the skin. We don't want to drag. I'm going to bring it up behind that ear, the same thing, because we want to get that blood flow moving. We're going to avoid the thyroid area. Every machine manufacturer has different instructions, but in this case, we're going to avoid that thyroid area. And there are really no contraindications with LED. The only thing would be if a client is prone to epilepsy or seizures because of the flashing light. That may be avoided of using that. Someone with migraines, perhaps, you would want to have them consult with their physician. And if a client is pregnant, they say not to use it. All right, so again, 1.5 minutes in each section. And you can see that that's off. We're going to bring it on to the next section. And we're going to bring it to its, okay, we're going to bring it this way, and here we go. And we're just, I have, like I said, my own rhythm. I'm holding the client's head, no pulling on the skin, very gently. Just nice, nice gentle movements. Going over the mouth area, over the cheek area. Now, because the light is bright, you may choose to use goggles over the client's eyes or little iPads. We want to get as close as we can. In our case here, our client knew what to expect, and we're okay. Get around that eye area. So the key is not to have a heavy hand. We want to do it nice and gentle. And you can see that blood flow, beautiful, just increasing as we move. So 1.5 minutes in each section. Now in our client's case here, around the mouth area is an aging, you know, she's getting a little premature aging in there, so we really want to work that as we go. And there's no discomfort with LED whatsoever. And I've been using the LED lights for over 20 years, and it really is impressive to me as a professional, the results that we can achieve. Okay, we're going to take it up to the, let's add that, up to the forehead, bringing it around, and just a back and forth motion. So it's really therapeutic even for the professional because it's quiet and it's relaxing for both the client and the esthetician. And LED can be used when we talk about anti-aging beautifully on hands. I mean, where do we age? Most people are the hands, right? So this is another treatment where you can be doing masks on your client's hands and then following up with LED. LED light therapy, one of the benefits as well, again, is the healing of tissue. So for those clients who may be suffering from any type of arthritis, that sort of thing, it can have a tremendous amount of benefit. Okay, and then we're going to move on to the next section, the other side. Start it again. And there we go. Good control. Same. And we'll end up bringing that down to the décolleté area and then doing another pass. Okay, we're going to now get ready for our second pass. I'm going to add a niacin cream that's going to help strengthen that skin with the highly refined herbal e-oil, and that is not going to clog the pores. It's going to help to moisturize the skin. And please notice we have more pink happening. Again, that's stimulation with the LED. It's all about increasing blood flow in a very non-aggressive way. Get behind that ear. And now we're going to go for our second pass. Starting again in the décolleté area. And why did we choose to then add something else? Well, in experimenting, and I really encourage all of you to look to see what you're using in your treatment room and how can you make your machines better? How can you get more out of that machine? And for us, that's exactly what we did, is looking to see, well, if I add this, what will happen with the skin? And if we do this type of treatment, what will happen with the skin? And then incorporating the LED. So I encourage you to experiment, of course, on yourself or on those very close to you, but look to see how can you get the most out of the machines that you have, the most out of the treatments that you offer to assist your client in achieving their skin wellness goals. We're going to do exactly the same process, bringing it up, and I'll just show you this pass here. Again, we're going to have the client keep her eye closed. We're going to get up in there. And like I said, goggles can be used, little iPads can be used. You do not ever want to directly put the light over the eye. And you want that client to have the eyes closed. Okay, and we're good to go. And this is pulsing so fast you can't even see it. So we recommend every 2 weeks. It can be done once a week or every 2 weeks. With our prescribing, we have the client taking care of their skin at home because that home use is so essential to healing skin. And the light therapy is still working within that skin in between treatments. So whatever your protocol is, you want to keep that in mind, that LED is a continual healing. It is still working within the skin and it's healing it. So you don't want to overdo. Now we have the panels now, which is very popular. We don't use that in our skin center. You kind of get used to what you get used to, but those also have benefits. So there's a lot of options now out there for the professional, and you just got to do some research to see what you feel most comfortable with. I personally like working with something that I can move in the treatment room versus a panel, but that's just because of what I'm used to, where I can take my probe and move it along how I see fit. Well, let me demonstrate here on this side with this particular. We have the one-sided, and you can see these are areas that we can work either over the nose or little areas like this that we really want to target, those target areas. And I always go back at the end when I've done my 2 passes and then just kind of focus in on this. It's also nice for the nose area, particularly if your probe, the larger one, is too big to go over the nose. You can take care of that as well. And some people forget that, you know, we're worried about the other areas because that's where the wrinkles and the aging happens, but we want to take care of that nose because that's where a lot of sun damage happens. And remember, LED light therapy helps with sun damage, in reversing sun damage. So again, this is just for little small areas. Okay, there you have it. Okay, we can see now after the LED light therapy how vibrant the skin looks. She's got a lot of color in there. We're going to finish her up with the moisture treatment. I'm going to add a nice, close your eyes, a nice little hydrating mist there. We're going to put some moisture back into the skin, highly refined combination of soy and E. And you can see, once again, everything is about increasing blood flow. We're moving that blood again. And now, something unique. We're going to do our one-of-a-kind moisture treatment using a little plastic wrap, as we're going to be using a hot towel, our facial wrap. And steam can be extremely dehydrating to the skin. It can deplete the skin of its nutrients, so we're going to protect the skin from the steam of the hot towel, but allow that heat, which is going to increase blood flow, move the product in, increase vascular activity. So you want to leave enough area for the client to be able to breathe, keep the nose and mouth area opened, cover as much skin as you can with the plastic wrap. We're going to lay our facial wrap over. And again, something very unique about the facial wraps that we use, at least, is underneath it's terry cloth, but it has the flannel on the outside, which is going to hold that heat longer. And that makes it nice, so you're not having to switch out hot towels. One hot towel will do the trick. And you're just going to kind of gently, we don't want to overstimulate. You can even do a little massage here, very gently. Remember, we've done a lot to the skin, nothing aggressive, but we have stimulated a lot. So a gentle massage will feel good to the client. We let it sit. Oh, it could even sit as long as a minute. And I always check underneath to see if this is still warm. If it's still warm, we're going to keep it on there because this will cool off quicker, the outside. And there we have it, and we're going to just remove this nice and slow. And again, what do we have? Beautiful, vibrant, radiant skin. You can finish up with a little massage in the décolleté area if you wanted. But you can just see that beautiful glow in the skin, that healthy, radiant skin. So there you have it, an anti-aging advanced treatment. Gentle, effective, that's the key, it's effective. So let's just kind of recap what we did. We gently cleansed the skin with a water-based pH cleanser. We then added an advanced treatment facial mask, and the purpose of that mask was to increase that vascular activity, tone the muscle, and to gently exfoliate using the papain enzymes. We then finished up with LED light therapy, which is a wonderful follow-up treatment to any other facial mask that you do in the treatment room, but it's also terrific just by itself as a treatment, just separate. And then the very last thing is the moisture treatment, which is going to increase that blood flow again and add moisture back into the skin. So simple, holistic, and non-aggressive.